Welcome everyone to this short video about the researcher's journey within SPHN. My name is Sabine Österle and I'm the lead for the Semantic Interoperability Strategy and the FAIR Data team at the SPHN Data Coordination Center. Before I talk you through the researcher's journey, I would like to say a few words about SPHN. So SPHN was established 9 years ago and is a network consisting out of multiple players within the Swiss healthcare and research landscape. It involves multiple hospitals, university hospitals, as well as cantonal hospitals, but also a lot of different other players around health data research in Switzerland. The activities of the SPHN are coordinated by its Data Coordination Center, which also I'm a member of. At the core of SPHN is actually the SPHN Semantic Interoperability Framework. So here, actually, we were like finding a strategy on how can we combine the different data about the patient. And of course, this is really complex because what we are talking about is real world data, meaning very diverse data because it has a very different level of complexity depending on which source system it comes from, and also, of course, depends highly of its sources. We normally have a biological level on top of it, layer on top of it. So this can be, for example, omics data, genomics, proteomics, lipidomics, but also it could be information about a profiling of the antibodies which you found in a certain patient sample. To actually be able to represent all of this complex information, we actually use W3C standards, so RDFS and OWL. And also we are using common medical terminologies like SNOMED CT and LOINC and many others to actually speak a common language and to actually be able to represent this complex data. This all gets into a semantic representation of the data. So we are not trying to harmonize the data, but we're really trying to bring in the semantic description of this diverse real-world data. And this is actually very challenging because it's a multi-layer data integration approach, but at the end, it actually generates us a knowledge graph with a comprehensive view of a patient. But how can a researcher within SPHN actually benefit from all of that? And what are the tools and services which SPHN has developed to facilitate his research? So when we start a project, actually, we need to find data which we can use. And actually, therefore, SPHN has established several metadata catalogs. For the one side, for example, we actually helped Swiss cohorts to bring their metadata into the so-called Maelstrom catalog, which is an international metadata catalog for cohort data. We also established SPHN metadata catalogs for datasets, so datasets which were generated within SPHN or sister initiatives and which can be reused. Also, we are currently doing a pilot to give a bit of visibility about what is the data which is actually available within a hospital, so within the clinical data platforms in the different university hospitals. And this system is called SPHN Data Exploration and Analysis System, and it enables you to do feasibility queries across all the hospitals. For example, how many patients do I have with a certain diagnosis and certain procedures being done on that patient. Also, it allows you to explore the data, to do hypothesis generation. For example, you can explore value distributions or also survival curves of different defined cohorts. When you have identified the data you want to reuse, either in a hospital or in a catalog, you have to actually fulfill all the ethical and legal requirements to be able to receive that data. So here SPHN has developed a set of templates which can be used for actually sharing data. So this is what we call the DTUAs, the data transfer and user agreements, but also data processing agreements and as well collaboration agreements, which helps you to organize the structure within your consortium. When this is done, actually, we normally have the challenge of how are we getting from the real world data in the clinics to the fair data, which we want to have in SPHN. And here, actually, we have established a large tool set, which is actually deployed in all hospitals, which help the hospitals to generate data according to the SPHN schema, to the SPHN knowledge graph, and really all provide the data in a similar way. When you have that data, or you don't have it yet, it's the question, where can I analyze it as researcher? Because of course, that data is still highly sensitive and requires special protection. And therefore, in Switzerland, we have established a trusted research environment, which is called Biomed IT, where researchers are provided with a secure infrastructure to actually be able to receive that data on that infrastructure and analyze it. And last but not least, when you are done with your project, you have a data set which can be made available for the reuse by others. And these data sets can be actually described on our SPHN metadata catalog. With that, I actually would like to thank everyone involved, everyone at the Data Coordination Center, but of course also all of our working group and task forces across hospitals and universities in Switzerland. And on the right side here, you can have certain resources in case you want to dig further into any of the services. Also, in case of questions, please feel free to contact me at Sabine Österle at sip.swiss. Thanks a lot for your attention.